Hello, I'm Nima Rajan. Prime Minister Justin Trudeau says the Canadian forces are being sent to northern Quebec to help communities there prepare to respond to COVID-19 outbreaks. In his daily appearance outside his Ottawa residence, Trudeau also says that the federal government is sending $100 million to organizations that help feed people who need assistance. The organizations who will receive funding include Food Banks Canada, the Breakfast Club of Canada, the Salvation Army, and others. The PM says the federal government has an agreement with Amazon to use its distribution network to send medical supplies to meet provincial needs. Meanwhile, Conservative leader Andrew Scheer has called for the federal Liberals to be more transparent about their response to the COVID-19 crisis. He wants the government to release national-level data on the spread of the virus and its implications. The Prime Minister said today that the provinces are working together to get data released and available to Canadians. Well, meanwhile, the Canadian Bankers Association says the country's 6 largest banks have allowed customers to defer payments on more than 10% of the mortgages in their portfolios as borrowers affected by COVID-19 seek financial help. The association says almost 500,000 requests for mortgage deferrals or to skip a payment have been completed or are in process. More than 2 million Canadians applied for employment insurance in recent weeks as a result of the COVID-19 pandemic, as businesses shut their doors or scale back their operations. Well, Google will start releasing movement tracking reports in a bid to help public health officials determine how successful physical distancing measures have been in the effort to contain the COVID-19 pandemic. The international tech giant says it will compile data to chart movement trends at retail and recreation spaces, groceries, pharmacies, parks, transit stations, workplaces, and residential areas. Google will make the reports available in 131 countries and will offer both provincial and national breakdowns in Canada. To maintain privacy, Google says it will only base the reports on users who have opted in to sharing their location history. Well, a regional government near Toronto is apologizing after revealing that it mistakenly mailed more than a dozen letters advising recipients that their COVID-19 tests were negative when they were actually positive. The Region of Peel's top medical official says the letters were mailed on Tuesday and Wednesday. Dr. Lawrence Lowe says his team is working to notify the 16 people involved. He says changes have been made to ensure the error doesn't happen again. Well, meanwhile, public health officials in Ontario are set to release data today showing how many people could die of COVID-19 under various scenarios. The province issued a new emergency order this morning to give public health units more flexibility through hiring retired nurses, medical students, and volunteers. Deputy Premier Christine Elliott also announced that people can now access their COVID-19 test results through an online portal. Province-wide, there were nearly 2,800 cases of COVID-19 as of Thursday, including 53 deaths and 831 resolved. Now, more than 40 healthcare workers at a Winnipeg hospital have been ordered to self-isolate after 2 staff tested positive for COVID-19. Health officials say some patients at the Health Sciences Centre will have to be shuffled to a different area of the hospital to cope with the staff shortage. Manitoba officials also say residents at a nursing home in Gimli are being checked for COVID-19 after a staff member tested positive. Now, moving to the United States, where the Trump administration is preparing to release new guidance recommending that many Americans wear face coverings in order to slow the spread of the new coronavirus. Officials are expected to suggest that non-medical masks, t-shirts, or bandanas be used to cover the nose and mouth when outside the home, while medical-grade masks would be reserved for those dealing directly with the sick. The coordinator of the coronavirus task force, Deborah Birx, has said that the White House is concerned that the mask guidance would lead to a false sense of security for Americans. Well, meanwhile, the White House says it is prepared to launch a $350 billion lending program to help struggling small businesses affected by the coronavirus. The Paycheck Protection Program will help small companies keep employees on payroll and remain afloat. The U.S. Labor Department announced that unemployment claims soared to 6.6 million last week, which is more than double the previous week. Now, experts in ethics are stepping into the fight against COVID-19 to make sure no doctor has to make life or death decisions alone. Choices such as who gets the potentially life-saving medical equipment and who doesn't have become stark realities in places like Italy and New York City, where hospitals are overrun with coronavirus patients. Officials in several Canadian provinces have been working with medical ethicists to develop guidelines for frontline workers. Well, meanwhile, U.S. President Donald Trump has invoked the Defense Production Act to expand domestic manufacturing of N95 protective masks by Minnesota-based 3M to assist first responders. A memorandum signed by Trump calls for DHS Secretary Chad Wolf to use any and all authority available under the act to acquire masks produced by 3M. Today, the Minnesota-based 3M says the Trump administration has asked that it stop sending N95 masks to export markets in Canada and Latin America. But the company, which calls itself a critical supplier of the masks to both markets, says there would be significant humanitarian implications to doing so. 3M says it has already been turning out as many of the N95 masks as possible for the U.S. market. Well, the World Bank has approved its first funds to help some of the globe's poorer countries combat the coronavirus outbreak. It approved a total aid of $1.9 billion for 25 countries. The largest amount of assistance was $1 billion for India, followed by $200 million for Pakistan, $129 million for Sri Lanka, $100 million for Afghanistan, and $83 million for Ethiopia. Officials say the approval of the first round of support for 25 countries will be followed quickly with aid for another 40. Well, doctors around the world are dusting off a century-old treatment to help fight the novel coronavirus. They're using the blood plasma of recovered patients to help treat the sick, which is a technique most famously used during the 1918 flu pandemic. Now, there's no proof that it would work against COVID-19, but some doctors hope it could be a stopgap measure while researchers scramble to develop a vaccine. Now, Prince Charles remotely opened the new Nightingale Hospital in London today. The temporary facility will soon be able to treat 4,000 people who have contracted the COVID-19 disease. The new National Health Service hospital will only care for people suffering from COVID-19, and patients will only be assigned there after their local London hospital has reached capacity. Other temporary hospitals across the UK are being planned. Now, moving to Tokyo, where the governor of Tokyo is talking about the possibility of using the under-construction Olympic Athletes Village as a temporary hospital for coronavirus patients. The massive village on Tokyo Bay was built to house 11,000 Olympic and 4,400 Paralympic athletes and staff. The complex will eventually grow to 24 buildings and is expected to remain empty with the Olympics delayed for 16 months. Well, the Cuomo brothers have become must-see TV for those keeping up with the COVID-19 news. Andrew Cuomo is the governor of New York State, while his younger brother, Chris Cuomo, hosts primetime on CNN. Now, Chris recently tested positive for COVID-19, and the governor has had him appear at his briefings over video stream to chat and check on his health. And on one occasion, Chris recalled hallucinating about his brother in a ballet outfit and dancing during a fever dream. Well, that'll do it for today's news update. I'm Nima Rajan. Thank you for joining us, and we will see you next time.